All right, for the last presentation, I chose the effect of different types of regular exercise on physical fitness in adults with overweight or obesity, systematic review, and meta-analysis. This is phase 5, effect of effective PA interventions, and then PA for adults is the section I chose. All right, so for the overview, this is a systematic review and meta-analysis that investigated how various forms of regular exercise affect physical fitness in persons who are overweight or obese. The study evaluated improvements in respiratory fitness and muscular strength by assessing randomized controlled trials on aerobic resistance, mixed training, and high intensity interval training across 66 relevant trials. All exercise regimens demonstrated improvements in VO2 max. However, resistance-based programs, alone or paired with aerobic exercises, were most beneficial for strengthening muscles. These results showed systematic exercise may significantly increase physical ability in this group, regardless of weight reduction. And for statement of purpose, finding the best exercise methods to improve physical fitness in overweight or obese people was the aim of this study. The analysis sought to separate the independent effects of exercise because previous reviews frequently concentrated on specific populations or combined exercise with dietary treatments. The researchers aimed to assist medical professionals in choosing exercise regimens specifically designed to enhance cardiorespiratory fitness and muscle strength in people with extra body weight by directly comparing aerobic resistance, mixed, and high intensity interval training. All right, so for method section, design, systematic review, and meta-analysis using Prisma. For search, 4 electronic databases were searched for original RTCs up to December 2019 using PubMed, Web Science, Cochrane Library, and Embase. Keywords used: exercise modality, maximal oxygen uptake, and muscle strength. For inclusion criteria, studies were included if they involved adults greater than or equal to 18 years old with overweight or obesity engaging in structured training, exercise training, or programs aimed to increase physical activity. For data extraction, 2 authors independently extracted data with standardized forms, including study design, participant characteristics, intervention details, and outcomes. Additional information was requested and received from 6 authors. For analysis, effect sizes were calculated from pre-post means and standard deviations, assuming R equals 0.5 if unreported. Meta-analysis used random effects models in Review Manager 5.3 with MD or SMD interpreting standard mean deviations as negligible, less than 0.2 to large, greater than 0.8. Heterogeneity was assessed and publication bias via funnel plots and Edgar tests when applicable. For the results, overall impact of exercise training, types of exercise and meta-analysis, aerobic resistance, combined aerobic plus resistance, and HIIT exercises. All training types increase VO2 max with a mean difference of 3.82. And then for muscle strength benefit, the incorporation of resistant exercises into the program is indicated. For cardiorespiratory fitness or VO2 max, aerobic exercise significantly improved VO2 max with a 12-week program showing the largest gains. For resistance training significantly improved VO2 max but was less effective than aerobic training. For combined aerobic plus resistance training, combined aerobic plus resistance training significantly improved VO2 max with no difference versus aerobic training. And then for high intensity interval training, HIIT significantly improved VO2 max and was significantly more effective than aerobic training. To continue with the results, for muscle strength, Aerobic exercise training showed no significant difference in effect on muscle strength. For resistance exercise training, resistance training resulted in a significant improvement in muscle strength with an SMD of 0.74. Combined aerobic plus resistance training, this type of training also improved a significant improvement in muscle strength with an SMD of 0.62. And then for HIIT training, no studies were found that investigated the effect of HIIT training on muscle strength in comparison to no exercise training. Comparison of training types for muscle strength. Resistance training was more effective than aerobic training in improving muscle strength. No significant differences were found between resistance training and combined aerobic plus resistance training for muscle strength. Other physical fitness parameters. Resistance and combined training improved flexibility, balance, walking speed, and overall physical capacity. Okay, for conclusion, practical applicable application for most important to least. Number one, for individuals aiming to improve muscle strength, it is important practical application is to include resistance training in their training program. Resistance training significantly increases muscle strength, whereas aerobic training alone does not. Combined aerobic and resistance training also effectively improves muscle strength. For number two, to enhance cardiorespiratory fitness, both high-intensity interval training and aerobic training are highly effective. HIIT was found to be slightly more effective than aerobic training in improving VO2 max. For number three, combined aerobic and resistance training is a valuable option as it improves both cardiorespiratory fitness and muscle strength. While it is equally effective as aerobic training for VO2 max improvement, it offers an added benefit of strength gains. For number four, when advising on exercise training to improve physical fitness, health professionals should consider the differences between training types in conjunction to the individual's physical needs and preferences. This personalized approach ensures better adherence and long-term success. And for number five, all training modalities, aerobic, resistance, combined, and HIIT, improve cardiorespiratory fitness. Resistance training and combined training also enhance other physical fitness parameters like flexibility, balance, walking speed, and overall physical capacity. For connecting to other research phases, examine physiological mechanisms and dose response effects of different exercise types. Conduct high-quality head-to-head trials comparing modalities across BMI and age groups. Test interventions in real-world settings to assess adherence, sustainability, and behavioral factors. Combine clinical and community-based programs to translate findings into practice. Then use evidence to form inclusive, scalable exercise guidelines for overweight and obese individuals. For strengths, comprehensive systematic review and meta-analysis on exercise effects in adults with overweight and obesity. Followed PRISMA guidelines and registered in Prospero, ensuring rigor and transparency. Stricter inclusion criteria and detailed comparisons of training modalities. And then broad population coverage, ages 18 to 75, BMIs of 26.4 to 40.5, and then VO2 max of 14.9 to 39.5. For limitations, moderate to high heterogeneity. Many included studies were fair or poor quality. Results sometimes changed when poor quality studies were excluded. Limited data for specific comparisons, HIIT versus resistance training, resistance versus combined training, and incomplete population subgroup data. Some modalities studied in younger or lower BMI participants. And then another limitation is the duration of the studies. Short were less than 4 weeks, and very long were greater than 26 weeks. All right, so for author's take, more direct comparisons between exercise types to help clarify relative effectiveness. Research should include standardized outcome measures to improve comparability. There should be a future focus on different BMI categories to determine whether training responses differ between individuals with overweight, obesity, or normal weight. And then longer term trials assessing adherence, sustainability, and physiological adaptations beyond 26 weeks. And then for personal take, integrate both physiological and behavioral outcomes to determine which exercise types are more effective and sustainable. Emphasize real world feasibility to ensure programs are practical, inclusive, and adaptable for diverse populations. And then focus on sustainability and accessibility of interventions. And finally, combine controlled trials with community-based approaches to enhance translation of research into real-world practices.